We are great. Let's get right to it because time is of the essence, and everybody wants to know your thoughts on this health care bill. Where are you, and what do you see as the prospects of this getting through the Senate somehow?
Well, where I am is we have to do something. The current system is imploding. Obamacare didn't work. It particularly didn't work on the individual marketplace where, last year in our state, we didn't have a county that didn't have two companies willing to offer insurance. Now we have 97 counties out of 115 where only one company will offer policies, and next year 25 of those don't have anybody already who would offer any insurance at all, and that's happening all over the country. 40% of the counties in America next year will only have one option, and then about 50 counties, half of them in Missouri, will have no option to buy a product that the law requires you to buy or pay a penalty. Medicaid, the states have expanded, believing that somehow the federal government forever would pay 100% of the expansion cost for the first few years and then 90% every year after that. It was never likely that would happen. That's what the Missouri General Assembly thought. And they were right in assuming if you did this, you should assume that eventually this will go back to whatever is the normal percentage. There are lots of problems. The big problem replacing it is you're trying to build a house inside a crumbling structure, and that's a lot harder, clearly, than it would have been if 7 or 8 years ago we'd have done the handful of things that would have made a real difference. And we still can do those, and hopefully a bipartisan group of senators will eventually be part of getting that done as well.
Do you think this bill does it, and how many changes are you willing to put up with? I mean, how much different is the final version than this version you're all right with?
Well, I think this bill or the final bill are likely to be an important first step in a three-step process. Step one is whatever we can do right now to stabilize the marketplace and create a path forward that still protects people with pre-existing conditions, doesn't set any lifetime cap on insurance, lets young people stay on their family policies. This bill would do that, and some other version of it might. But step two is the Secretary of Health and Human Services looking at the 1,446 places in the current law where it says somebody at that department normally will define what this means further. And Secretary Price is pledged to look at every single one of those 1,446 places and see if there's not a more economical for families and individuals way to define the law. And then the third thing, Kelly and McGraw, is for Democrats and Republicans to say, okay, how do we get it to where more people can get insurance as a group? What do we do about buying across state lines? All of those things are going to take Democrats and Republicans working together, and certainly I'm willing to do that.
One of the things that always comes up on the show is even if you have no insurance and you break your leg, you can still get service and get health care and see a doctor and get your leg fixed at a hospital, even though you didn't pay into the system and don't have the money to fix the leg. So what's the incentive for somebody to buy insurance if they can still go to the hospital and get their leg fixed?
Well, I think there's no likelihood that we'll do away with that concept where everybody has access to critical health care. What we don't have now, even many people with insurance don't have access to health care because the deductibles are so high. They're just almost like the person without insurance totally, in that you can't go see a doctor about the kinds of things that make it likely you'll stay well. We need to move from just covering people in a critical environment to where insurance coverage is really health care coverage, not catastrophic coverage. The average policy sold under Obamacare has a $6,000 deductible, and if it's a family, it has to happen. Could happen as much as twice before you no longer are paying your own bills. So $12,000 deductible for a policy that you're likely paying for. People that have individual insurance now, even though the projection of the Congressional Budget Office was that today there'd be 25 million people in that program, and the program just didn't work.
Quickly, because I want to ask you a couple other things. What are you optimistic this will get through the Senate?
I think it's hard to do. I think that there's a real effort a tremendous effort being made to find a way to go. The thing step two is starting. Two becomes step one, and we'll have to work harder to make step three possible.
I want to ask you about the Trinity Lutheran decision in the Supreme Court, 7-2 decision. What are your thoughts as you watch that come down? Senator, we got a bad connection. Senator, we're going to have to let you go. We got a really bad connection. How about? Well, I certainly we don't want to hang up on the senator, but we lost him. Senator, we'll try and get you back at your.
I can hear you, so
yeah,
see you soon.
Okay, we'll get back.